Well, good afternoon. My friends, I've spoken before about how the crisis has taken a toll. It has taken a toll not only on physical health, but mental health as well. People are really struggling out there, and we have to be there for them. Our first responders, including our police, have done an incredible job these past few months, and I have to thank them for everything they do, and our mental health workers as well. But when you get that 911 call, you have to be ready for anything. We know there are more mental health emergencies now than ever before. In fact, our police officers respond to tens of thousands of mental health calls every single year, and that number continues to grow. People don't know where else to turn. More situations can go downhill real quickly without the social supports we normally have. It's important that our police receive the training and the support they need to respond to these calls. It's very important they have backup from trained mental health professionals who can help them de-escalate situations and get people the help they need. So today, I'm sending in reinforcements for our police and mental health workers. We're investing $37 million to significantly expand mental health services across the justice system, including hiring additional staff, expanding mobile crisis teams across the province, and supporting tailored programs for First Nations communities. Last year, we invested in additional mobile crisis teams. These are specialized teams that bring together police officers, mental health workers, and other first responders to handle mental health emergencies and assist people with severe mental illness. We're going to deploy more of these teams in 33 communities province-wide, including in northern and Indigenous communities. This is a major step forward for many communities. It means that a patient may not have to tell their story 2 or 3 times or wait in a hospital emergency room to get the one-on-one care they need. It means that a police officer may not need to wait for 5 to 6 hours with them in an emergency room. It means a mental health specialist, rather than a doctor or a nurse or a first responder, stands ready to help that person. This ensures people get the appropriate help they need immediately, and our frontline staff are free to assist others. Minister Tibollo will share more details in a moment, but I want every single person in Ontario to know you're not alone. We're all fighting the same battle right now, and we are fighting it together. We are stronger than this virus because we have each other. If you're feeling depressed, burnt out, or isolated, please reach out. You don't have to dial 911. You can click a button or pick up the phone to talk to someone who cares and who can help you. And for those who want to lend a helping hand, I encourage you to volunteer for one of these organizations. We're all in this together, and we'll get through this together. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Tibollo.
Thank you, Premier, and good afternoon. As part of Roadmap to Wellness, our plan to build a connected and integrated mental health and addiction system, we're proud to be investing $37 million to significantly expand access to mental health services across Ontario's justice system. These services will support the challenging work being done by the many brave women and men of Ontario's law enforcement services every single day. It will also lead to better supports for individuals living with mental health and addictions challenges and assist Ontario's frontline heroes in handling mental health cases. This funding will bring much-needed supports to Ontario's justice system, including supportive housing programs designated for individuals involved in the justice system, mobile crisis services, as well as for safe bed programs to support them, addictions and withdrawal specialists to support safe bed programs, enhanced addictions programming within adult correctional institutions, mental health and addictions peer supports for offenders under community supervision, a corrections peer support program, and mental health and addiction supports for vulnerable and marginalized persons as part of the Ministry of the Attorney General's Justice Centres. No matter where you live in the province of Ontario, we have made it our mission to help protect the hardworking women and men on the front lines and ensure they have access to the support they need, especially during these difficult times. By significantly expanding access to these services across Ontario's justice sector, we're providing the right tools to help keep Ontario's communities safe. Peu importe où vous vivez dans la province de l'Ontario, nous nous sommes donnés pour mission de protéger nos policiers et de nous assurer qu'ils ont accès au soutien dont ils ont besoin, surtout en ces temps difficiles. En élargissant considérablement l'accès à ces services dans tout le système de justice de l'Ontario, nous fournissons les bons outils pour aider à assurer la sécurité de nos collectivités. Merci, thank you, and I would now like to welcome Minister Elliott to the podium.
Thank you, Minister Tibollo. Our government's top priority is the health and well-being of all Ontarians, and that includes mental health, because mental health is health. The funding we are announcing today will help provide more resources for mental health and justice services to better support individuals with mental health and addictions challenges before or during a crisis. This investment and our holistic cross-government approach to mental health and addiction services is a key component of Budget 2020, Ontario's action plan. It is also a critical part of our government's $176 million investment this year in our Roadmap to Wellness. Supported by a commitment to invest $3.8 billion over 10 years, Roadmap to Wellness lays out a detailed plan for creating a comprehensive and connected mental health and addiction service system that will offer Ontarians high-quality services and supports where and when they need them. During our consultations around the province, we heard from hundreds of Ontarians, and we kept hearing the same messages. Wait times are too long, people do not know where to get help, and fragmentation makes it hard to understand and navigate the system. The Roadmap to Wellness is our plan to fix these long-standing challenges. Our government is working collaboratively across sectors to provide long-term stability in our mental health and addiction system, including in our justice system. We are making it a priority to ensure that all Ontarians who need more mental health and addiction support have access to the high-quality service and supports they need. And now I'd like to invite Minister Jones to the podium. Thank you.
Thank you, Minister Elliott. The COVID-19 pandemic has challenged our communities in unprecedented ways, and its impacts have added pressure and strain on the mental health of Ontarians. No sector has been free of these challenges, and the frontline workers who support essential services in our justice system face particularly complex circumstances. In the community, police officers are often called to respond to situations involving individuals in crisis. We know these situations can often be better addressed by a support system that includes a mental health worker. That is why our investment supports the implementation of mobile crises teams, which assist police in de-escalating high-pressure situations and connect individuals with the mental health services they need. Police officers are always there to protect our communities, and we will continue to ensure they can draw on the resources they need. The COVID-19 pandemic has also underscored the need for targeted supports to ensure frontline workers are equipped to meet the challenges that exist in Ontario's correctional facilities. This investment includes funding for mental health programming specific to the needs of corrections staff and their environment by offering peer-led support. In addition to supporting our frontline workers, these programs help to reduce the stigma surrounding mental illness. Most Ontarians will never witness the vital work that corrections staff accomplish each and every day, and yet we do not take their contributions for granted, which is why we are continuing to commit to supporting corrections staff. To help prevent crime, break the cycle of offending, and improve community safety, we are providing mental health and addiction support for those in custody and under community supervision. This investment will also enhance access to culturally relevant services and programming. By significantly expanding access to mental health services across the justice system, including our frontline workers, our government is taking urgent action to ensure the health and safety of all Ontarians. Thank you.
We'll go to the phone line for questions. First question, please.
Your first question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. We just heard from Minister Lecce, who says he's in discussions with Dr. Williams about the future of in-class learning and suggested that he may announce in a week or two that they're being shut down for an undisclosed amount of time, possibly an extended Christmas break. And parents are hearing this and wondering, how do they prepare? So what can you say to parents on what they should be doing to prepare?
Well, I know the minister is sitting down with the Chief Medical Officer of Health. I know he'll be coming out very shortly to make an announcement. But our goal, all of us, I think, as a province, what I'm hearing out there is parents want their kids in school. And, it's working well. Out of the 4,828 schools, we have one closed. So again, the credit goes to all the teachers and the principals and school boards and Minister Lecce. But, the kids have taken a lot of time off, and the kids love it. I was just talking to my niece and nephew last night, grades 8 and 9, and they love going to school because it's good for mental health. It's good for them to get out, and it also gives the parents a little bit of a break as well. But I know Minister Lecce will come out in the next little while with an announcement until parents can prepare.
Follow-up?
Thank you. And my follow-up, so when parents are hearing this news today and they are wondering how do they prepare, what can you tell them as far as what they should be doing right now to prepare for what sounds like a very possible closure of in-class learning for a short amount of time?
Well, let's not confirm that until the minister sits down with the Chief Medical Officer. Then he'll be able to come out. So I just don't want to jump the gun here and say be prepared. It may not happen. So let's wait for the minister to come out.
Next question.
Your next question comes from Randy Rath with CHCH TV. Please go ahead.
Hi, Randy.
Hi, Premier. We're doing a story today on restaurateurs and some councillors in the Niagara region who think that the 10-person cap for indoor dining is unfair in that larger restaurants can accommodate more people and allow for social distancing. How do you respond to that?
Everything with COVID's unfair. I hear them loud and clear. These folks are struggling. They're just trying to get ahead. But after I heard the 6,500 per day potentially, that scares everyone. It scares me. It scares everyone. But we have to do what the Chief Medical Officer's guidelines are saying, and the local public officer of health is saying as well. I'll pass it over to the Minister of Health. Thank you.
Well, as always, we have been listening to what the Chief Medical Officer of Health and the Public Health Measures Table are advising, and we're following their recommendations. And there is evidence that there is a direct link, unfortunately, between COVID spread and transmission within restaurants, bars, and other locations. So we do need to take this seriously. It is unfair, but we do need to take this seriously to try and bend this curve, get these numbers much lower than they are now. And we do know that by taking some of these measures early, we can avoid more complete, more protracted lockdowns later on. So while it's difficult to make these decisions now with the situation we have, we need to do this so it doesn't get much worse.
Follow-up?
Okay, and yesterday, Dr. Williams was saying that he's hopeful, or he hopes that all of our regions can be in the green zone by Christmas. That seems pretty much like it's not going to happen. Shouldn't we be preparing people to plan for a smaller Christmas with just their family, their people that live in their own homes, so that they don't make grand plans and then just ignore the health rules?
I think so, but Dr. Williams, you know, he's a positive doctor. He's always looking at the glass as half full, and we all have to stay positive. We all have to have hope, because there's hope out there that we will get back to where we were before. But yeah, I'd be very cautious at Christmas, extremely cautious. All of us will have a better idea in the next couple of weeks, 2 or 3 weeks. Randy, you know, he always asks me so many great questions, as you did today. But did you see the ridiculousness things happening in Etobicoke, those 100 people in a public storage? Folks, this is what I'm talking about. This is a new one. So they go out to party, and I guess they rent a public storage area, and 100 people go in there to hold a party. Like, come on. We know a certain percentage of those people, just going by what we see the data, like someone in that group is probably positive, and they're spreading around, and those people are going to go out and spread it around. Man, like I just give my head a shake when I hear these things. 100 people in a storage unit. Like, really? That's all I'll tell you. It's just, nothing ceases to amaze me now with the behavior of some people. It's absolutely ridiculous. So anyways, you usually ask me those good questions, Randy.
Next question.
Your next question comes from Lorenda Redekop with CBC News. Please go ahead.
Hi, Lorenda. How you doing?
Premier. Just following up on what Randy was saying there with Dr. Williams' comments from yesterday about Ontario possibly being in the green zone by Christmas. We've heard a lot of criticism of this, kind of putting it more in the category of possibly a Christmas miracle. Like, is this something that you stand behind, and is your government actively working towards this?
I haven't had an opportunity to speak to Dr. Williams today, but I'm always sure there's more of a background story to it. But I'm happy that he's positive, and let's pray that happens. I'm going to pass it to the Minister of Health. Thank you.
Well, of course, we are very hopeful that all of Ontario will be in a green situation before the holidays, but I don't think it's something that we can count on at this point, and we are watching the data every day. We're looking to see what's going to happen in those areas that have been put into the control situation, particularly Peel and Toronto, and Dr. Williams and the team will be coming out with more guidance for us all to follow in the next several weeks, but I think he is being very optimistic. That is of his nature. But I think we also have to remember that each and every one of us has a responsibility here and has a role to play by following the public health measures that we've talked about many times. If we want everyone to be in the green zone, we all have to do our part.
Follow up?
We're seeing recent reports of test positivity rates for various neighborhoods. There's a part of Brampton and also some parts of Toronto that are close to 20%. Yeah. What more is happening in those neighborhoods, and what more will your government do to protect them?
Well, we're putting mobile testing units through these hot zones, and again, I was up to the one in north of Etobicoke, and we're just going to continue being vigilant. and making sure that we do proper testing and proper contact tracing is absolutely critical. But if you don't mind, I'm going to pass it to the Minister again. Thank you.
Well, we are providing a number of supports to the areas that are in the red zone, Peel, Toronto, Ottawa as well. And what we're doing is to provide more pop-up or mobile testing units. We're also allowing for limited walk-ins at assessment centers because in some neighborhoods there may be language or other difficulties. Maybe people don't have a computer, they can't go online to book an appointment. So we want to make sure that everyone who needs a test will be able to go in and get a test. But we've also put in additional provisions for case and contact managers to assist the local public health units in following up with cases that have been diagnosed, to follow up for the people that they've been in contact with. We've allowed for 200 extra case and contact managers in Toronto, 150 in Ottawa, and we started with 70 in Peel, but we're continuing to build in Peel. But we also have 10 public health units that are not having high case volumes that have volunteered to help with telephone support. So we're providing many resources in all of these areas to make sure that we can get the case and contact management and testing done, in addition to the $1 billion that we're putting into testing, tracing, and contact management. We're putting those resources in those areas that are hardest hit with COVID right now.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. Just to get back to the school situation, so how much would you expect the Christmas break to be extended? And if things are going as well as they are now, why would you extend it with only one school closed? Of course, I bear in mind that the more cases we have in the community, the more risk there could be to schools.
Exactly, yeah. So we, again, Rob, I think the parents, honestly, I think the parents, I think everyone wants to keep these schools open as long as we can. But the minister is going to sit down with the chief medical officer. He'll make that decision, bring it over to the cabinet, and we'll collectively make that decision.
Follow up?
Yes, thanks. I've got an email from a reader here whose mother gets a COVID-19 test in Bracebridge every other Tuesday so she can visit her husband in long-term care. Her most recent test was a week ago today, and she still doesn't have a result. When I'm looking at the numbers, I don't see a huge backlog in testing. So is there a snag in that part of the province, or is this a broader problem? And how can it be fixed?
I don't think it's a broader problem, but that's a big issue. And remember I said I had a conversation, we had a meeting yesterday at 2:30, and I mentioned that. It's unacceptable that it's taking a week. And I'm going to be very transparent. It happened to Carla, my wife. It took a week for her to get an answer. And when you have a loved one in there, be it her husband, or in Carla's case, her mother, they don't want to be there away from them in a week. I still go back to every single staff member needs to get tested 100% on a weekly basis, and so do visitors. But the thing that we have to fix is this: we have to get down to 24 to 48 hours. And, I know the vast majority of tests are coming back in 1, 2, 3 days, but a week's unacceptable. I'm gonna have to look into that, Rob, because something that's unacceptable. That's all I have to say. It's happened to that woman. It's happened to my own wife. So how many other people is it happening to? But what I mentioned at the table, I want hardcore data, which I will share with the public. I want to see the percentage of the people that are getting tested and when they're getting the results back. Because if you wait a week, that's not good. You know how many people have contacted in that week, probably? Even though they say, oh, stay at home, it's not the reality. They got to go buy food and everything. In my opinion, we have to do a better job on that until not 80% of the people are getting a 24-hour service or 48. We need 100%, and especially long-term care. Number one priority is long-term care, locking these places down.
Last question.
Your final question comes from James Murray with Net News Ledger. Please go ahead.
Well, good afternoon again from Western Ontario and the best part of the province, Premier.
Great. Always good to hear from the folks in Western Ontario.
Now, this announcement today on additional mental health support, this is a good start. What we see here in Thunder Bay in particular is we have a lot of the calls that our Thunder Bay Police Service respond to, which are mental health related. We get people into the jail system. The jail in Thunder Bay, I don't know if you've toured it, but it looks like a medieval castle and the conditions are terrible. What can be done to help people in Northwestern Ontario, Northern Ontario, and Western Ontario to become, addiction-free? The jails might be a start, but what we're seeing is a lot of people released on conditions, including no drinking and no drugs, but they have an addiction issue. So even if the court system is giving them counseling, how are we going to make this work?
Yeah, I'm going to hand it to my ministers, but something, I've seen it firsthand when I've been up to Thunder Bay, and it's concerning. But I'm going to pass it over to the Solicitor General and then over to my Minister of Mental Health.
Well, thank you for the question. You're absolutely right. That is why we have done the pathway to wellness, because we understand that it is cross-jurisdictional, it is cross-ministry. And in Thunder Bay in particular, of course, we have made the announcement that we are rebuilding a new jail in Thunder Bay to acknowledge the fact that their numbers continue to increase, but the mobile crisis teams that are being embedded with police officers, as those 911 calls come in, and we're seeing upwards of 45% are actually mental health related calls, it is truly going to be a game changer to embed mental health workers with police officers so that when that phone call is made, the connections with the community supports are there and can happen immediately. I'm very excited about this announcement, and I'm so pleased that we've been able to work together across government to make it happen. And I'll turn it over to Minister Tibollo.
Thank you, Minister. Addictions and mental health is something that the government has taken very seriously here in the province of Ontario. Appointing me the First Minister responsible has given me the opportunity to work with my colleagues across ministry and be able to look at the issues, the fundamental underlying issues when it comes to addictions and mental health. I've had the opportunity to tour most of the province, from remote communities to the rural communities, and of course the different communities in the GTA. And one of the things that we understand is that mental health really weaves itself into so many different aspects of who we are and what we do in the province. Thunder Bay in particular needs support, as do many of the other communities. And what we're doing with the Roadmap to Wellness is developing a strategy that actually connects the existing services, and where the gaps exist, look to put those services in place. And our initial investment of $174 million last year, $176 million this year, and an additional $174 for $350 million, is looking to identify those gaps, working with the stakeholders and listening to the people of the different communities so that we provide the services and supports where and when they're needed. And we know that by doing this, we're going to make a difference. It's going to take time, because this government is the first government that's made such an historic investment in mental health and addictions. But we're starting to see the results already with collaboration between different service providers, looking at strategies that are unique to each of the communities, because circumstances change depending on where you are in the province. So we're continuing to do that work and continuing to implement our strategy. And with an investment of $3.8 billion over 10 years, we will make a fundamental difference to addictions and mental health across the province.
Follow up?
Now, that's a good start again, and I think we're on the right track here. Yep. Some of the areas that are still lacking seem to be in victim services, so families aren't getting some of the support they need. Will this be available in this program?
I'll pass it back to the Solicitor General.
So absolutely, the Ministry of the Attorney General is also part of our cross-jurisdictional, cross-ministry approach. We understand that when an individual has a mental health health crisis, their family also needs support. So what we are doing is making those investments both at the victim side and with the individual. And again, I must reinforce, the need for us to look at mental health across the continuum of care is so critical. We have been doing that as a government by having Minister Tibollo lead a standalone ministry, but it is because of the cooperation that we have with the Municipal Affairs and Housing, with additional supports, with the Attorney General, victim supports, with the justice sector, with embedding mental health crisis workers, with the hospital patient transfer that allows police officers to be able to transfer in a much smoother and respectful way individuals who are in a mental health crisis to our emergency rooms without further stigmatizing them by having them sit in a waiting room for 4 to 6 hours. There are so many pieces that we are working together with from a ministry standpoint that I believe that you will see true transformations of this sector and people will get the help where they need it, when they need it.
Thanks, everyone.
Thank you.